Welcome again to the Elevate Hot Podcast brought to you by MediGlobal. I'm your host, Jeffrey Rennie, and I have an amazing episode for you guys today. We're going to have a person I've known my entire life talking about a very important field in the medical industry, nurse practitioners. And again, when we're talking about this conversation, we're going to go over what they do, their role in the medical community, and just some, experiences that my guest has had as a nurse practitioner. So with that being said, I am so happy to introduce my guest, Betty Paul. Betty and I always call her Betty Andy, so I'll be referring to you as Betty Andy. I can't call you Betty Paul. So Betty Andy, she's been a nurse practitioner now for 8 years. You've worked at the VA for God knows how many years, and
14 years.
it's an amazing thing, your journey from RN and everything. And so thank you, Betty Andy, for being part of the program and being able to share your experience with us. How about you give a little bit of a synopsis of your journey and just where you come from and the whole nine of your professional journey, I mean.
Okay. Thank you for having me here.
No problem.
My name is Betty Paul. I am a nurse practitioner for last 8 years. I came to United States in 2005. I did diploma in nursing in India. Then I migrated here. I worked in the ICU for last 10 years. Not last 10 years, but when I came here, I worked in the ICU for 10 years. Then went back to school. I did my BSN, then master's, then again I went back and I did my DNP. I did my DNP at the University of South Florida.
South Florida, go Bulls, yeah, for sure.
I graduated in 2019.
Mm-hmm.
I'm working as a nurse practitioner at the VA in vascular surgery since 2016 when I graduated with my master's.
Yeah.
So,
And
last 9 years.
A wealth of experience, so you know exactly what it is that you're talking about. You're not. It's so funny. We just had like a baby nurse on the podcast that's only been a nurse for like 2 years at TGA. Yes. So this is like the other spectrum where you've seen anything and everything. Mm-hmm. So we're so happy to have you.
Thank you.
One of the things that we get questioned on here and we see all the time is what are these different things? Because you have PAs, NPs, AAs, so many different, CNAs they like to be called. What would you say is like your description of a nurse practitioner for people that don't know what it is?
So, for nursing, there are different specialties. The nurse can be a certified nurse midwife, clinical nurse specialist, CRNA or nurse practitioner, or psych nurse practitioner. Is based on what they learned, what is their passion, and what they are specialized in. For me, I did a master's in nurse practitioner program, then the DNP after that. So I'm a nurse practitioner. So I have a friend who is a psych nurse practitioner. So she did her master's in NP. After that, she did
a specialty in psychology. Gotcha.
Nurse practitioner.
Very cool.
So like that, according to our passion, we can choose.
And as a nurse practitioner, you guys are different than, a regular nurse in what ways specifically?
So the regular nurse usually take care of the patient at the bedside. They are there, like we need nurses 24/7 for the patients at the ICU. Nurse practitioners, they are more in diagnosing the problems, prescribing the medications.
Oh, wow.
For the follow-up. Yeah. So they work collaborating with the physicians. So for the Florida, we have to have a collaborative physician. For the specialties, for the primary care, we can work as ourselves, as independent.
But even when you're prescribing medicine, you don't necessarily need doctor's approval. You can just prescribe the medicine.
You diagnose and prescribe the medication.
Wow. Yes, okay. Yes. Gotcha. And one thing that was interesting is that you guys have more of a nursing model than a physician model. Can you speak to what that means?
Physician model, they are like completely autonomous.
Yeah.
Nurse practitioners, it differs state by state.
Yeah.
In Florida, the primary care nurse practitioner are autonomous. 100%.
Mm-hmm.
For the specialties, we have to have a physician
Gotcha.
to get collaborated by. So we work under the doctors
Mm-hmm.
in the specialties like cardiology,
Psychiatry.
psychiatry,
Mm-hmm.
the neurology. So for the specialties, we have to work with the collaborating with the doctors. For the primary care, we have independent practice in Florida.
Oh, okay. So
Yeah.
basically, whatever, like if
Yeah.
I just needed like a general checkup or whatever,
Yes.
I can go to
Yeah.
a nurse practitioner's
Yes.
office, get
Mhm.
like whatever prescription I need through
Yeah.
them, and
Yeah,
get
they
that
can order
support.
the labs, they can do the diagnosis, they can order the medication, then can interpret the radiology findings, everything. Then they can treat you basically.
What is the like timeline? Like, can someone just do you need certain years as a nurse to become a doctor and nurse practitioner, or do you need a few, or can you just go straight from school? How does that work?
So to become a nurse practitioner, you can go directly after the BSN.
You can go
the
straight.
MSN,
Oh,
right?
okay.
But we always recommend to have some bedside experience,
Mhm.
so that will help us to understand the patients and the situations better.
Yeah, because
than
you have
new
to,
graduate.
because there's always the difference, right, between what's in the textbook versus what you
Yes.
actually see.
One actually we see at the
Yeah.
bedside is
For
different.
sure.
So we always recommend it's always best to have the bedside experience before we become nurse practitioner.
Okay.
That will
Gotcha.
help us to do our job better and to approach the patients in the better way too.
And could you just a little? I know we talked about like a lot of things. Can you just talk about like the educational path that people go through, like in terms of college, post grad, all that stuff, and just kind of what that looks like.
So for me, I did my diploma in nursing in India. Then after I come here, I did my BSN. Then I did my master's in nurse practitioner from South University. Then I went to University of South Florida for my DNP. So to become a nurse practitioner, we have to have master's in nurse practitioner degree, the minimum. We have to get licensed from the state.
Gotcha. Now, my biggest question too is just what does it look like on an everyday basis? So we talked about the educational piece. What is it like on the day-to-day piece of that? Like, give me a glimpse of that.
So if you ask me what I do day by day, I work for the vascular surgery.
Yeah.
I work for the surgical team at the VA. My each day is different.
Yeah.
At least 2 days in a week, I see patients in the clinic.
Mm-hmm.
I see new patients. I see post-op patients. Then I see established patients too. If they have any problems, if we did any studies, we are coming back them with the reports, everything. Then some other days I do the history and physical, like pre-operative preparations for the patient. As I work at the surgical team, the patients come for the surgery. We see them in the clinic. Then we do the HNP.
Oh, okay.
Pre-operative preparation.
What is DHNP? What does that stand
The
for?
history and physical. Like
okay.
To know the patient better.
Okay.
To teach the patients the correct thing.
So you kind of take the role of the doctor almost with the
I don't go to the operating room to do the surgery. The surgeons do it.
Of course, yeah.
But I do everything else.
Yeah, the post-op, pre-op.
Post-op, pre-op.
Exactly.
Then the teaching is very important too.
Mm-hmm.
The patients come with a problem, but they don't know what is their problem. So we teach them. They are having aneurysm. They are having carotid artery stenosis.
Yeah.
So if they don't get treatment, they can get a stroke. If they have aneurysm, it can rupture, they can die. So we teach them what can happen if they don't have surgery, why they have to have this surgery.
Yeah.
Then we teach them how we are doing the surgery.
Yeah. Exactly.
Make the incision like this, then take this part out, suture it, close it. Then we see them after the surgery too for the post-op visit, how they are doing, how they are coping with the surgery, what is their possible complications if they have any, wound healing, wound checks, everything.
And that's a huge part, that educational piece, because in this day and age, self-determination is like everything, right? Like you want to go in and give a person like all the information as possible to say, hey, these are the potential impacts of you doing the surgery, good or bad, right? So
Yes.
having that person, go in, and I'm sure it must be frustrating, like if they don't do it, going against medical advice, but at least from that perspective, you're giving them the information to make the best choice for themselves, right? So that's
Yes,
huge.
I have seen patients, they don't want to have surgery. They have aneurysm like 7 centimeter, 8 centimeter. They can rupture and die any time, but
Yeah,
they choose not to have surgery.
for whatever reason.
So still we see them to make sure they have enough knowledge to make that decision.
100%.
If we think they are not compatible to make that decision, we refer them to psychiatrist and let them make that decision.
Yeah, because they have to be obviously competent,
Competent. They have to
able
be
to go on.
competent
Yeah,
to make that decision. They don't want surgery.
yeah,
If they are competent, we teach them what all things can happen if they choose not to have surgery. If they accept it, we honor their decision.
yeah.
We help them the plan A, plan B, all the situations.
And it's so like important having that different perspective too, because from a nurse, you're coming from a more bedside care, like you see the things they have to deal with every day, so it's not just, hey, like I'm just giving, like you understand, like, hey, like these aren't just like small little complications that you have to deal with. These are potential life altering things, so being willing to go in and like obviously extending the person's life, that's why people go into healthcare. We're trying to save people, but having that perspective too of like, hey, I've seen what this potentially will do to you, like understand this is a consequence of that. That's really huge. How is that, what can you give me some examples of like when that has gone like in both those ways, where a patient has refusing care and kind of the consequences of them refusing care?
So we teach them the potential complications if they defer the treatment. Then we make sure we understand it. We make sure the family is aware of it. With the permission of the patient, we talk to the family members, to wife, kids, whoever they prefer.
Their loved one,
Then as a specialty provider, I notify the primary care provider. This is patient's decision. This is his problem, this is his decision, and this is what he wants to do. So the primary care can plan the care according to that.
Understood.
We always honor patient's decision.
For sure. That makes sense. That makes sense. Now, I know we're talking about like day-to-day things and everything. As an NP, I'm sure you see certain patients all the time or certain problems all the time. If there's a certain health PSA that is out there, like what is something you see all the time, and what is your recommendation to stop seeing this problem all the time,
The problems we have in healthcare, basically we have problems in access to the healthcare. So I wish there is like more clinics, more facilities to how the patients to get into the access healthcare.
Gotcha.
So that is very important because nowadays to get a primary care appointment, patients are waiting.
Really? Yes. How long are they waiting for?
It depends upon where they are. So at the VA, when we get a consult, we have to see them within a month.
Yes.
So,
but that's just the VA though. VA.
Outside, they can wait like 2 to 3 months to get the appointment.
Jeez, and by then that problem may have gotten like ballooned to something a lot worse.
Yeah, if they have any emergency, they can go to the ER, they can go to the urgent care. They can have the sick visit, but for the regular primary care appointments, they have to wait.
And that's it's also like the idea of like preventative care, right? Like you don't know what you don't know, so by delaying something, if you're able to go in earlier, you see a problem earlier, then man, like we can cut it from the root. We don't even have to wait for it to escalate, right?
Exactly.
So that's and I get and understand from like a physician perspective, from your perspective, from a nurse practitioner, man, like if we could just get these people in on time, like then we'd be okay. Kind of going, similar to that, is there like also issues with like Medicare and Medicaid and that type of stuff? Like, have you worked with those type of populations?
No, I haven't worked with Medicare
Or med-
patients because
mhm.
at the VA, all of them are
Veterans,
veterans.
yes, yes,
So
yes.
it's different.
Mm-hmm.
We treat them
Yeah.
regardless of their.
Because that's like another thing too, because some people aren't even Medicaid providers, you know what I mean? Like some,
Yeah.
like your insurance company, like we always talk about like United Health and all these different like healthcare companies and who's a provider and who's not a provider.
Yes. Yes.
And that also makes it such a tough thing from the consumer side, of course, because
Yes.
you're so limited on your options at
Yes.
that point. And then you have to go through all these hoops. So yeah, that's always something that's like, I'm sure something that's a struggle for talking about, what your daily life and everything like that. What are some of the tougher cases that you have to deal with? Like, what are the cases that you kind of dread working with, or is it just for you kind of like whatever? How does that like go out for you?
The main difficulty is for the appointment. Sometimes we have to wait to give the appointments to the patient. Then they may not show up.
Oh yeah, no shows.
The
Yep.
no shows. Then sometimes we have to have CT scans, certain images before we see them, and they are no show for that too. So and they sometimes they come to the clinic without doing all these pre-requirements.
Yeah,
So
yeah.
those are like difficulties. Then for the follow-up appointments, even after the surgery, when we tell them they have to have this imaging or they have to come to the clinic after 2 weeks, 3 weeks, most like some of them are like no shows.
Yeah, yeah.
Then we have to go behind them to bring them back to the clinic to do the needed studies, all those things.
Yeah, and it's so funny. Like, I was just talking to a CAA, a certified anesthesiologist assistant, and he like emphasized, just like you are, the importance of listening to whatever your provider is asking you to do. Like small things, even like for a surgery, don't eat anything before. Like
Yeah, don't
because
take the blood thinners, don't
yeah,
eat in the morning, don't take the insulin if you are not eating. So
yeah.
sometimes they forget
Sometimes they forget, but
to
sometimes they
follow the
lie about it
directions.
too, which becomes an even bigger problem for them,
Yeah,
because
yeah,
if
yeah.
you lie about eating, you could literally choke or not have like, get like, the anesthesia have an impact on that. So again, I always like to say, if your person tells you something, be honest with them, be upfront, because they are only doing it for your best benefit,
Yes, yeah.
They
Most
aren't,
of the patients understand that.
yeah,
They don't lie if they had breakfast or anything.
yeah.
But sometimes they forget.
They forget, yeah,
Yes,
100%.
because of their
And don't
age.
forget.
Yeah,
Don't
yeah. They
forget.
forget not to hold the blood thinners, to hold this medication, that medication. They just forget.
Yeah.
Because of like different reasons, they can forget.
Is there any other challenging parts of the job aside from, dealing with having the healthcare and things like that when it comes to patients?
No, like at the VA is very established.
Yeah. Shout out the
So
VA. The VA is
yeah,
great.
so I'm so lucky to be the part of the VA.
Yeah, well.
It's like well set
Mm-hmm.
organization.
Mm-hmm.
So we get all the facilities to work there.
Yeah, yeah, and
There is some issues with the like access to the healthcare or those things.
but the actual work is not something, and I feel like I'm sure you could talk about it. Like if you go in and you do all these years, you have a passion for this, so
Yes.
you understand. Like, hey, like whatever, like that's healthcare too. In essence, you're helping people at their lowest point. So some of these things, I guess, come with the territory, I guess, right?
Yes.
Yeah.
We have like specific population of patients we care for.
Yeah.
As I work in the vascular surgery, I see my patients are like mostly smokers
Mm-hmm.
and they have
Lung cancer.
basic problems like high blood pressure, diabetic. So if they are not controlled on their diseases, the situation can get worse. So health teaching is very important.
Yeah.
We have to tell them quit smoking, but Quit smoking
It's
is
not
not
easy.
easy.
Yeah,
It's not
definitely,
easy.
definitely
We
not.
have to
Yeah.
help them to go through that process.
Hmm.
We have to give them some medication to support that,
Yeah.
and they have to have support from the family
Yeah.
also. Sometimes the patients are willing to stop smoking, but their partners, their kids, they are still smoking.
Yeah.
So
Because it's
it's
all.
not a easy decision, it's easy thing for them to do.
Yeah, and it's also like the resources, right? Like giving them
Resources.
resources like outside in the community because there's a million things out there.
Yes,
But
yes.
it's always funny. I think that in the hospital you have such a controlled like level environment where
Yes,
everything's being
yes.
monitored. But you take that person and you put them back in their
In the
environment where there's
they are
stressors, where
back.
there's
Yeah,
things.
yes.
It's very
It's
difficult
very difficult.
for sure.
Yeah, I always understand the patient situation. So I tell them, if you keep smoking, even though if you do the surgery to fix this, that problem
They'll
can
come up,
return.
but yeah,
You can
100%.
come back. We teach them as much as we can, but we cannot change their life situation.
100%,
So we
100%.
will have to work with them with knowing their situations too.
Mm-hmm. And kind of going on the opposite side of things, what would you say is the rewarding part of this job, being like specifically as a nurse practitioner
Mm-hmm.
compared to being, just an RN?
I used to have job satisfaction as an RN too
Yeah,
on the
yeah,
other
yeah.
side. Yeah.
RNs are great. We love RNs.
Yes, yeah. I
For
love
sure.
RN. I'm still an RN.
Yeah, for
Yeah.
sure.
With the nurse practitioner thing, I do different job now.
Yeah.
So as I work in the surgery, when I see the patients recover from the surgery, their wounds healing, we are trying to avoid the amputation in most of like all the patients. So
Mhm.
when those things are happening, we are like that
Mhm.
happiness is like
Yeah,
incredible.
for sure, for
Yes,
sure.
yeah. Then for some patients, they have to have surgery, they
Hmm.
have to have amputation. There is no choices. But when we see them back, we follow up with them, and they get the prosthetics. They walk. Sometimes after the surgery, they walk to the clinic on
Oh,
prosthetics.
wow, yeah.
That time we are like, oh my God, this is so
Yeah,
amazing.
for
Yeah,
sure.
yeah. So
Because
it's so
they were in
rewarding.
such a tough situation,
Mm-hmm.
and you see them
Yeah,
overcoming it. It's
yeah,
it's
yeah.
really great to see.
We are not correcting everything, but
Yeah,
we help the patients to go through the difficult situation. If they
definitely.
have to have, if they have to lose the leg, they have to lose the leg. But we teach them how to adapt it,
Hmm.
then how to move forward.
Yeah,
So they can have prosthetics. So we refer them to the appropriate
yeah.
services, and they work on them. They get the prosthetics. Then they walk again.
And it's so crazy just how
Yes.
far prosthetics and
Mm-hmm.
everything
Everything
has to
working.
working
Mm-hmm.
right now.
Mm-hmm.
Like I just see like all these like things on Facebook and
Mm-hmm.
Instagram of like these electronic prosthetics where they're able to like have new hands that are
New
able to
hand.
hold
Yes.
things and
Yes.
punch
Yes.
things. I'm
Yes.
like,
Yes.
it's a really amazing
Mm-hmm.
time
It's
in medicine.
amazing. Yeah.
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 And being part of that journey, I'm sure, is because you see them at their lowest point. So
Yes.
now you see them also overcome that big hurdle. So
Yes. Yeah.
that's really awesome to
Yeah.
see. And what would you say, for that person that is going into, from an RN to a nurse practitioner, what are those things that you would say also are some benefits of being a nurse practitioner? What are those other benefits?
So for a nurse practitioner, most of the time they don't have to work night
Yeah.
shift.
Oh, that's great.
Yeah.
Yeah.
For nurses, they have to be. We need nurses 24/7.
Yes, 100%.
And the
100%.
nurse practitioners, they can do day shift.
Yeah.
There is no weekend.
Mm-hmm.
In some categories there is like on calls, weekends, rotation, all those stuff. But in most of the cases, we work Monday to Friday. It's
Yeah.
like an office job. We
Yeah.
see the patients. Then the patients are like more healthier when they come to the
Yeah.
clinic than they are in the
Yeah. Yeah.
ICU.
So the people you deal
So
with too.
so
Yeah.
we can serve them differently. So
Gotcha.
we can teach them more, and that bedside, sometimes they are in coma, sometimes they are sedated, intubated. So the health teaching is like different. Of
Gotcha.
course we can teach the
I
family
understand.
when they are awake, we can teach them. So it's like different perspectives in different fields.
Plus the paycheck's a little bit better, right? So that's
It's
always a
better
good
too.
thing.
Yes,
That's
it's
always a
better.
good thing, right? And
Yeah.
it makes sense too, because I always look at it from the perspective of like responsibility, right? Like with
Yes.
everything, you are now being more responsible for these
Yes.
patients.
Yes.
You're making more
Mm-hmm.
decisions, more calls
Mm-hmm.
versus so. With that paycheck also comes more like responsibilities and headaches. I'm curious, have you ever had like any type of concerns with like any legal things, any liabilities? I talk to my doctor friends all the time, and they're
Mm-hmm.
always worried about getting sued or something like that. How is
Yeah,
it?
that can happen. Like when
Mm-hmm.
we see the patient, when we prescribe medications, we have to be like very careful. Like
Mm-hmm.
we have to check their allergies. We have to check if they have any bad experience with that medication before. So we have to be like very careful. We have to be more responsible than RNs in prescribing. Like the RNs don't prescribe, only the nurse practitioners and doctors prescribe. So we have to be careful. It's definitely more responsible job.
Yeah, and one last thing, just coming from like a future perspective, what is that one advice you would give to someone starting in going into nursing? I this because you've been through both
Mm-hmm,
sides of the
mm-hmm.
mountain. What would you say you would give to a new nurse? Just general advice, and just what advice would you give them on like why they should or shouldn't become nurse practitioner here?
So to the new nurses, find out what is your passion. Yeah, you know what is your possibilities. You can be a nurse practitioner, you can be a CRNA, you can be a psych nurse practitioner. So know different fields, then choose what is best for you. So I think that is the best teaching I can give.
For sure.
Know what you can be, and if you have passion in one field, pick it. Go for the right education, right school, then right certification, get licensed, then work.
Okay. And there's so much information out there. We get bombarded all the time. I just want you to just give me one thing that you feel like is people don't know about nurse practitioners that they're unaware about, just things that is a kind of a misconception about them.
The nurse practitioners, they can do so many things.
Mm-hmm.
Um, they can prescribe medication, they can have autonomous practice in the primary care, then in the specialty they can collaborate with the physicians and work in different fields. Whatever is the passion,
Mm-hmm.
they can do so many things
Yeah,
as a
and
nurse practitioner.
And on that note, I always like to do a segment with anyone that comes in here because there's so much misinformation, like I said, and we do a section called Fact or Fiction. Basically, what we do here is that I'll give you just a general thing that is being said about the topic, and you just tell me if it's a fact or fiction.
Okay.
Does that sound okay?
Okay.
You're doing great, Betty. By the way, you're doing amazing. So, NPs only work under a supervision of a doctor.
That is wrong.
Okay. Can you
In the
explain?
primary care,
Yeah. Yeah.
we have autonomous practice in Florida. We can see the patient, we can prescribe the medication, we can do the follow up. For the specialties, yes, we have to collaborate with the physicians.
Mm-hmm. Okay. And yeah, you said that directly. So straight fiction, 100%. You
Yes.
guys are not just always under a
Mm-hmm.
doctor. Fair
Yes.
enough. And this is something that I get all the time. NPs and physician assistants have the same role.
Physician assistant, the name itself says they are physician assistant.
Yes.
They always have to work with the physicians.
Yes.
For nurse practitioners, in some states they have autonomous practice in all the fields,
Yes.
even primary care and the specialties. It
Mm.
varies state by state.
Okay. Gotcha.
But they're different work. They work differently.
100%.
EAs and NPs work differently.
Because like you said, it's not just physician is literally in the name and they work under a physician
Physician,
model,
yes, yes.
versus nursing, it's a
Nursing,
very much a nursing model
nursing model,
Yeah.
but we can work with the physicians
as well.
as well.
100%.
Yes.
100%. And my last one is NPs are a stepping stone to becoming a doctor. Like if you want to become a doctor, you would go into being an NP.
So nurse practitioners can achieve the highest education level, that is the DNP, doctorate in
Yes.
nursing practice. That is the highest level.
Mm-hmm.
It's not doctor of medicine.
Yes.
So
yeah.
if we have to be doctors, we have to go back to medical school and
Yeah.
learn the degree.
And that's a wholly
That is all
different
different
track.
thing.
And
Some nurses are doing it.
Yeah.
Their passion is to become doctors. Even after they become NPs, DNPs, they drop everything, go back to medical school
Yeah.
and earn that degree.
Good for them.
Yes.
That is great. But
I'm so proud of them.
Yeah, that's amazing. But I also think in my head, that's a lot of studying. Oh
That is a lot of
my,
education.
that's a lot of education.
But they will make difference in the patient care.
100%.
Like once they were nurse and they are doctors, surgeons, they understand the patients more.
100%.
Yeah.
And I get like you see a different perspective. And again, it's your life. You do whatever you want to do. Self-determination. I'm a huge proponent of it. But I'm just always looking for the perspective of to become a DNP, you're looking at your BSN, then a doctorate, then you're working for a few years, then you go and basically start back going into medical school, then you have a couple years of residency. That's a
long journey.
It is a very long journey to do
that.
But
if we are determined like that, we can do it.
And part of it too is like, and I think you talk about it as well, there's a passion that you have for medicine.
You have to have the passion.
Yeah. People aren't doing this just to, get a paycheck at the end of the day. They do it because they really love medicine. So at the end of the day, if that's what you're passionate about, that's what you want to do.
Yeah, we have to go for our passion, not for the paycheck.
Yeah, 100%.
Yeah, even if nurse practitioners make same as RN, I would go to school and learn more.
100%.
Yeah, and do the nurse practitioner job.
For sure.
It's not about the money.
And even just side tangent, you still go to classes, right?
I still go to classes.
You still are like every learning continuous, yeah.
We went to school like maybe 5 years ago, 10 years ago. Things change.
Mm-hmm.
So we have to have updated information.
For sure.
We have to work under like evidence-based practice. So then so we get the current knowledge from going to the conferences, going to classes here and there, so to be updated.
Yeah.
So in that situation only we can give the correct treatment to the patient.
Because you're a lifelong learner. This is not medical.
It's a lifelong learning.
Because medicine is, like you said, always evolving. That you can't just stay stagnant. Yeah,
it's changing.
100%. And and again, that's part of what you sign up for with medicine. You have to have a really big passion for it. Yeah. But Andy, thank you so much for coming in, being part of our podcast. Before you go, is there something you want to talk to our audience about? Just one little nugget of advice you would want to give them before we end this day.
So as I said earlier, find your passion, get correct education, keep working in that way, and keep learning. Keep learning. There is no end point. Keep learning all the time. So that way we can help the patients in the better way. Thank you.
Thank you again for joining us at the Elevate Health podcast. We really do appreciate all your support. Please like and subscribe. If you have questions or comments, please put them down below. Betty Andy, thank you again for being part of the program. I'm your host, Jeffrey Rennie, signing out. Peace.